Okay, great. Thank you for inviting me. I'm excited to share this information with you. I'll just tell you next when we want to move the slide forward. So we'll go to the next slide.
Yes.
Okay, so what we'll talk about tonight is what is healthcare transition, why is it important, and then what steps you can take to ensure a successful transition. Next. So this visual gives you kind of a commonly used definition of healthcare transition and its components. So we talk about healthcare transition as being the purposeful planned movement of adolescents and young adults with and without special healthcare needs from child-centered to adult-oriented healthcare systems. And we typically talk about it happening in 3 phases. The first phase is actually a process. It starts at ages 12 to 14 and occurs over time up until that young person is about 21. And it includes preparing the young person for increased responsibility for healthcare self-management, having them understand and plan for changes in their healthcare needs, in their insurance, and then in their providers in adulthood. So again, this is a process. It's a lot of skills that are learned over time. Then we have the transfer of care, and some people mistake transfer for transition, but transition is this process. Transfer of care is the discrete event moving from one provider to another. And in this context, we're talking about discharging from a peds provider and enrolling with an adult-oriented provider. And that typically happens between ages 18 to 21. And then we talk about that transition being successful when patients are actively engaged in and receiving ongoing patient-centered adult care. Next. So why is that important? So without adequate support in moving from pediatric to adult care, youth and young adults may lose their insurance. They may have decreased access to health care, decreased medication compliance, increased ER visits and hospitalizations, and ultimately just a decline in health and poor outcomes. Next. So we'll talk tonight about goals for a successful transition. Next slide. Kind of in the overarching umbrella, when we talk about goals, we think of that young person being in charge of his or her own health around medical decision-making, disease self-management, learning about prevention, substance use, safety, and sexuality. We want that young person to be able to appropriately access adult services. That includes primary care specialists, therapies, equipment, supplies, whatever their healthcare needs indicate. We want them to have adequate and continuous health insurance. And then ultimately, we want them to be able to implement their education and vocational goals. Because really, you know, health is a means to an end. And the end is an improved and high quality of life. And that involves attaining, you know, that young person's education and vocational aspiration. Next. So we've identified 10 steps to successful healthcare transition that we're going to go through tonight. I'll just list them here briefly, and then we'll look at each one a little bit more. So we want to start early. We want to focus on responsibility for healthcare. We want to create a health summary, create a healthcare transition plan. We want the young person to maintain wellness. We want them to integrate healthcare transition activities into the school setting whenever possible. They should know options for health insurance and public assistance programs. They need to be able to find adult-oriented providers. They need to learn about community services and supports. And then they need to include health in all the other areas of their living, which could include school, work, and independent living situations. Next. So the first step is starting early. So we really encourage young people to begin preparing for transition at 12 or 14, certainly no later than 14 or 15. The young person needs to be able to assess their current knowledge of the health condition and their ability to use healthcare services and resources and being able to manage their condition. So we really want them to look at moving from being dependent to independent to interdependent. And there are a lot of readiness assessment tools that are good tools to help youth identify their current level of self-management. For example, in that kind of dependent stage where they don't know, the assessment will help them to know how to do things better. Once they kind of understand that they need to learn more, the assessment will help them understand how to better learn how. If they're learning more, how are they learning? As they become knowledgeable and independent, what are they really skilled at doing? And then that final interdependent stage is being able to know when to ask for help from their team, which can include providers and caregivers and family members, and get the support that they need to live successfully in adulthood. And it's really never too early or too late to talk about your healthcare needs. Okay, next. Second step is focusing on that young person taking responsibility for his or her own health care. It should be based on age and abilities. Step by step, young people can become more independent by learning skills like being able to talk to their doctor, being able to ask questions, scheduling appointments, arranging transportation, filling their prescriptions, and taking medications on their own. Next. We've got a lot of resources and educational materials that we've developed at Florida Hats, and on our website we share those along with materials that have been developed by other agencies and programs. These self-management guides were developed and versioned for different age groups. So Since You're Not a Kid Anymore is for middle schoolers. Now That You're in High School obviously is for high schoolers, and When You're 18 are for young adults. These booklets are really great in terms of getting that young person to think about taking more responsibility for their own health care, what it means to become an adult, and really developing self-advocacy skills. They're very interactive and targeted towards that young person. So I would encourage you to take a look at those and use them for the age-appropriate person that you're working with. Next, please. We also have posted on our website some really excellent little videos. Some of them were developed at Jacksonville Health and Transition Services here in Florida called Jack's Hats. And they're typically 2 to 3 minute videos that were primarily developed for young people that have developmental or intellectual disabilities. So they're very visual, very directed, very pragmatic in skills that these young people need to be able to do, like being able to use the telephone to schedule an appointment, learning how to arrange transportation, knowing how to fill out the appropriate papers at your doctor's office. So those are available on the Jack's Hat sites. And then there's also a website called Healthy Transitions that has these some additional videos that are really excellent. Next. And then there are all kinds of apps that are constantly changing and coming out that are available to help youth and young adults manage their own care. So just a few of them. MediSafe is a app that provides education about medications and conditions and shares the progress. Care Zone is a way to organize health information. It includes automatic reminders about taking medicines, creating a medication list, reminding you when you need to refill a prescription. MedCoach is an app that reminds youth and young adults to take their medicines. And then the Healthy Transitions mobile app really helps young people build skills for independence and manage their own health care. Okay, so step 3 is that, and this is actually important for anybody, not just a young person going through healthcare transition, is you need to have a health summary. You really need to put your information about your personal health in one place, including your medications, your diagnoses, hospitals, doctors' contact information, emergency contact plans. You really need to have that accessible. There are lots of ways to do that now. You can either put it on a thumb drive, you can take a picture of a hard copy and keep it with you on your phone. You can keep a paper copy, but there are lots of different templates that can be used. Next, I'll show you a couple of forms that you can download on the Florida Hats website. There is a template from Got Transition. There's a healthcare transition summary that has developed specifically for healthcare transition. My Health Passport is a really nice summary in that it was developed for people with developmental and intellectual disabilities. And so it's very visual and very easy to read. Very simple language. So all of those are available for download on the website. Okay, next. Step 4 is to create a healthcare transition plan. So it's really important that you work with your current healthcare team. That could be your primary care provider, a nurse coordinator, a social worker, but really get something down on paper. Create a written transition plan, and it should include your future roles and responsibilities, services that will be needed, who's going to provide the services, and then how the services will be paid for. Next. So on the Florida Hats website, we have some booklets that we have developed in context of creating a transition plan of care. So the planning guides on the slide are divided into 3 age groups. So you've got a planning guide that's specifically targeted to 12 to 14-year-olds, one to 15 to 17-year-olds, and one for 18 and older. So that the guides are made to help youth at each of the age group master the skills and then help them identify goals and master them prior to adulthood. Next, please. Step 5 is to maintain wellness. So we really want that young person to establish healthy habits early that will continue into the adulthood. And that includes learning about and talking with adults regularly that they trust and healthcare providers about risky behaviors such as alcohol use, smoking, sex, and building healthy relationships. And one thing that is really important is that a young person should spend some time alone with their pediatrician at every office visit. And that is important in that it allows them to learn how to start communicating with their doctor as they become an adult and see an adult provider. They'll need those communication skills. So developing that while the youth is seeing a pediatrician is a really important skill building activity. Next. So, these are some resources that are on the website. There's one called Sexuality Across the Lifespan, and there are versions that are developed for parents and caregivers. And there's also a version that's developed for educators, for teachers. It's a really good resource, again, targeting primarily children and adults with developmental disabilities. There are several apps that go to maintaining wellness, including Coach Me and Checkmark. Okay, next. Step 6 is integrating healthcare transition activities at school whenever possible. So as you've identified those goals in the transition plan, you need to try to include them to the extent that you can in IEPs and 504 plans. Florida Hats has also developed a lot of resources for educators. We have some training modules that are posted on the Florida Hats website that are developed specifically for teachers and talk about how to effectively integrate healthcare transition goals into IEPs. We've developed a curriculum called My Healthcare. It's on a website called CPALMS. And is available to all the educators and teachers in Florida. Got Transition has lots of resources for educators as well. So if you want to go to the next slide, this looks at some of the types of activities that you might want to consider integrating into an IEP or a 504 plan. Things like understanding your own needs and your required accommodations, knowing your medical supply, equipment, and medication needs. Those could all be goals in an IEP or a 504 plan. Certainly self-determination and self-advocacy goals, learning healthcare self-management skills and knowing about health insurance. And we also talk about, just having volunteer activities and recreational activities, because that's so important in developing work and social skills. So those could all be integrated into a IEP plan as well. Next. So step 7 is knowing your health insurance and public assistance options. So with health insurance, you really need to know the type of insurance plan, eligibility requirements, financial requirements, public assistance, things around finances, work, housing, medical equipment, respite care, and home health. Next. One resource that we have developed over the years is a health insurance guide called Just the Facts, the 411 and health insurance for young adults ages 18 to 30 in Florida. It's actually not just for young adults, because we cover health insurance options for really just about anybody. And while it's focused on Florida, some of the things are specific to Florida. There are also there's lots of information on Medicaid and Medicare and some of the federal programs and marketplace plans that are available. So in this guide, we really talk about what all the options are, whether it's public, private, school-based, employer-based, marketplace plans. We go through the options. We kind of give some tips about what you need to look for, what might be good or what might not be so great about each of the plans, and cost considerations. So that's downloadable from the Florida Hats site as well. Next. These are just some issues that you might need to consider that are factors in preparing for transition around health insurance. Aging out of childhood health insurance plans can create gaps and loss in coverage. If that young person has a temporary job, the benefits may not be available, or if they are available, they're very limited. You want to go back a second? Okay, yeah. Or they could have high premiums. If that person is receiving any kind of public benefits like SSI or Social Security, an increased salary could lower or eliminate their public benefits. And then also just important to know that even if that young person had Medicaid in childhood and they qualified for Medicaid in as they become an adult, the actual Medicaid benefits are much less robust for adults than they are for children. So there are differences between the actual benefits and the plans between adulthood and childhood as far as Medicaid. So those are just some of the issues and the barriers and factors that need to be considered. Okay, next. And so we've developed several information briefs or fact sheets around some of the social service programs and public benefit programs that certainly, you know, families need to know about, providers need to know about. They're usually just 1 or 2 pages long and kind of explain what the issues are and then provide some useful links to get more information. So we've got some we call the transition to go information briefs. We've got one in voc rehab, one on home and community based waivers. There is we've got other fact sheets from other agencies on SSI and SSDI. Those can all be downloaded from the Florida HATS website as well. Next, please. And then we've got, and the school to work vocational rehab transition to go. Just a note that, you know, this is a really important resource for young adults that have any kind of disabilities. They can help pay for job training and post-secondary education that leads to vocation. So we really recommend that you apply to voc rehab 2 years before leaving high school. But you might want to take a look at this transition to go brief. Next. Step 8, finding adult providers. So if that young person is still in the care of a pediatric providers, you need to start looking for a primary care physician and specialists who provide care for adults. It can be frustrating, you know, don't get frustrated with the process. It can take several phone calls or visits before you find the best one for you. And obviously there are a lot of considerations, including geographic location, your insurance plan, who's in network, who's out of network. If you go to the next slide, please. In Florida, we have developed this service directory that is searchable by community and then by the type of service or program you're looking for. And so it's a nice directory that can help youth and young adults in the community become aware of services and providers in their community. So, you know, looking at service directories, word of mouth, and certainly your insurance plan, or with the help of any kind of care coordinators or providers are really the methods and the strategies that can be used to identify adult-oriented providers. Next, please. Step 9, learn about community services and support for adults with special needs and abilities. So it's important to be knowledgeable about the rights and responsibilities of 18-year-olds. A big issue for many young people that have intellectual and developmental disabilities are decision-making options, such as guardianship. A good way to learn about community services and supports are joining community support groups. Next, please. One that we've developed a transition to go information brief on guardianship and decision-making alternatives. So it covers things like power of attorney, supported decision-making, guardian advocacy, long-term financial planning, such as a special needs trust. And then there's a screenshot here also of a brief that was developed by Got Transition. So there's a lot of information that is available, but definitely something to consider as that young person becomes an adult and turns 18. Next, please. And then step 10 is including health and other areas of transition, because you may need to provide documentation of your medical condition and healthcare needs in order to qualify for other programs and agencies. It's really important to ask your primary care physician to provide that information. It may be required for accommodations in college, housing, transportation, or other areas of independent living. Next, please. So all of these materials are available on the Florida HATS website. So this is the website that really serves as a clearinghouse for transition education and resources in our state. As Teresa mentioned before, it's a program of our Title V program, which is located in the Department of Health. It's called Children's Medical Services. And so we invite you to visit the website and certainly learn more about the resources and download any of those materials that are appropriate for you. Next, please. And then Got Transition is the National Center for Healthcare Transition Improvement. It's a phenomenal website. It's a phenomenal program. They have developed, Got Transition has been instrumental in really kind of crafting policies and developing tools. They have what they call the 6 core elements for healthcare transition, which are tools that were developed for providers to implement healthcare transition in their practices. They have tons of resources and you know, in every category that is you can think of for transition. So definitely want to suggest visiting the Got Transition website and looking at their toolbox. They've got a lot of information around education and health insurance and a lot of these other areas that we talked about this evening. Okay, I think that's it. Next. And so this is my contact information, and then Johnny Hollis is the program director at Children's Medical Services in our Florida Department of Health. So I appreciate giving me this opportunity to talk about some of these things. I know that that was kind of a brief run through. So I guess we want to open it up for any kind of questions or discussion at this point.